All right, I think it's about to start. So, good morning, and once again, welcome you all for the today's session. We feel very happy to welcome you for another wonderful session for this month. And last month we met on March 21st. I hope all our members would have received your CEOs, and that was a very busy month. It was Ramadan, right? And now it's after a month from now Ramadan now, right? Almost all our members are in the normal regular business now. We hope all of you all are staying safe and healthy. Okay, and let us go to our today's topic. I know you all are familiar with this topic, that is mastering genitourinary coding, right? So when it comes to the importance of genitourinary coding, we need to maintain an accuracy, and it's essential due to the clinical complexity and the high prevalence and regulatory sensitivity of the conditions that affects our genitourinary and reproductive system, right? So the diagnosis and accuracy is very much important to code the outpatient encounters, and also the selection of DRG for the inpatient encounters. So when we come to this topic, we selected Miss Hanna, and who is an experienced medical coder with over 6 years of professional experience in this field, in the medical coding field. Currently, she is holding a position of as a speaker and team leader in the coding operations, and she ensures compliance and healthcare regulations are being maintained regularly. With extensive hands-on experience and in-depth knowledge of her coding systems, in-depth knowledge in the coding system, insurance guideline, and clinical documentation, she brings a valuable practical insights in the coding field, and also today's session as well. We can see a lot of information in her slides, and we believe that's going to be helping our members. On behalf of all of you, I would like to welcome Ms. Hanna to start her presentation. Hanna, please, the stage is yours. Please go ahead.
Hi, good morning, everyone. Hope you all of you good doing well. So, I warmly welcome you all today to the session on Introduction to the Genitourinary and CPT Medical Coding Guideline. My name is Hannah, Certified Medical Coder, and I'm honored to be speaking today on behalf of Abu Dhabi Local Chapter of AAPC. It's a great privilege to share this session with you all. And today we will explore the anatomy, functions, and most importantly, the coding aspects of genitourinary system. This session is especially useful for the medical coders, healthcare professionals, and students who want to strengthen their understanding of CPT coding guidelines. By end of the session, you will have a clear idea about the structure and function of genitourinary system and common procedures and services, important coding guidelines and tips. So let's start with mastering of genitourinary coding. So before that, guys, did you know that one small coding mistakes in medical billing can cost a hospitals thousands of dirhams? So let's talk about the important aspects of coding today. So hope you all of you can hear my voice clearly. So let's start with the seminar disclaimer. Yes. So this presentation is intended for educational and informational purpose. The medical coding information provided is based on current industry guidelines and applicable regulatory standard. While every effort has been made to ensure accuracy, coding practice may vary depending on payers' policy, clinical documentation, and update to official guidelines. The instructor does not accept any responsibility or liability regarding errors, omissions, misuse, and misinterpretation. This material is intended as an educational guide and should not be considered as a legal opinion. So, guys, just introduction to the genitourinary system is a combination of two closely related systems in the human body. So as usual, the system we are going to discuss about the urinary system and the reproductive system. The system work together to perform essential functions related to waste elimination and reproduction. So, guys, before going to coding guidelines and the tips of everything, we'll check the anatomy and function of the urinary system and reproductive system. So, first of all, let's introduce what is meant by urinary system. What are the main responsibility for that? See the system, you can see the kidney, the two ureters, the urinary bladder and urethra. The picture it's showing the wall common urinary system in both men and female. Here you can see the responsibilities. Can you see that? Filtering the blood and removing the waste products. This is one of the main responsibility for the urinary system. And maintain the fluid and electrolyte balance in the body and producing, storing and eliminating the urine. So the blood filtration, that is the main process happening inside the kidney. And after that, producing the urine, storing the urine and elimination process. So this is the main urinary system, the common part in both men and female. And at the same time, what is meant by reproductive system? As usual, in men and female, the reproductive system is entirely different. So the functions of the system is same, the reproduction. So guys, the reproductive system is a group of organs responsible for producing the reproductive cells. We can also call gametes, male gamete and female gametes, enabling the fertilization, supporting the development of offsprings, and secrete the sex hormone. The male and female sex hormones are producing by the help of this reproductive system. So the reproductive system is again divided into two types, male reproductive system and female reproductive system. So first of all, let's see the male reproductive system, guys. What are the main organs included in the male reproductive system? So the main organs are, first of all, you can see the testis. This is the main part which helps to produce sperm and testosterone hormone. And epididymis, you can see that the epididymis is the part after the production of sperm which stores the sperm in the part of epididymis. And the continuation, you can see the vast difference which transport the sperm during the time of sexual intercourse. And you can see that prostate gland, seminal vesicles, these are the accessory glands mainly helps to add the fluid to the sperm and it finally transforms to semen. So the penis, after the production of semen, the penis will helps to deliver the sperm to the vaginal part of the female. So these are the main area of male reproductive system. So the urethra, can you see the urethra here? This is also connected with the penis. So guys, the penis helps for both urination and ejaculation in men. The releasing of semen and releasing of urine through the urethra, which is connected with the penis. So the main function of male reproductive system is sperm production, hormone secretion, testosterone, and transport the sperm to the female reproductive area. So this is what male reproductive system. Now let's see the female reproductive system, guys. What are the main organs in the female reproductive system? Here you can visible that the female reproductive system showing internal parts and external parts. External parts means that you can locate an external part of the body, which is like, see this mons pubis, clitoris, labia majora, labia minora, hymen, vaginal opening, urethral opening. These we can consider as the external part of the female reproductive system. And vagina, this is the birth canal. Okay, and the external part we can also consider as external genitalia. So guys, after this you can see the external part of the female reproductive system, which is the portion which starts from opening of vagina, then you can see that cervix, see that opening of uterus, and the uterus is the one of the main which helps for developing of a fetus, and the uterus is connected with the two fallopian tubes here. Can you see the picture, guys? The fallopian tubes, which is the two bilaterally connected, which connected with the ovary. The ovary, that is the main area, the female gamete, which helps to produce egg, the female ova or egg, and also the female hormones like estrogen, progesterone, etc. So the main function of this female reproductive system is also the egg production for the fertilization and pregnancy and childbirth and production of egg, hormone secretion, estrogen and progesterone, and also helps for menstrual cycle regulation. So these are the female reproductive system. So guys, now we discuss what is the normal urinary system and men and female reproductive system. Hope you understood, all of you. Now let's see what are the common diseases affecting in the urinary system. So there are too many diseases are there. So some examples are given here. You can see that urinary tract infection, UTI. This is the one of the common disease usually happening to the patients. And kidney stone, calculus. You familiar with that? And renal failure, kidney failure. And prostate enlargement, that is, maybe you heard about that BPH, benign prostate hyperplasia, especially in men. And gynecological disorders, this is for the female. So too many disorders are there, just showing few examples only. Now let's see what are the common genitourinary procedures. I'm going to show you what are the common treatment or procedures we are doing for the diagnosis and therapeutic. So see this urinalysis, ultrasound, cystoscopy, catheterization, dialysis procedure for the failed kidney patients, and nephrectomy, removal of kidney, prostatectomy, removal of prostate gland in the men, and circumcision. Lots of procedures are there. It's showing some few examples only. Okay, so guys, this is the overall structure of the functions and anatomy and the common diseases and procedure in genitourinary system. Now let's see, before going to the CPT rules and regulations in genitourinary system, let's see the important coding concepts for surgery. As usual, this genitourinary system, it's a part of the surgery in our CPT. So first of all, for everyone having a basic knowledge about what is the thing we are going to take and everything. Hope you all of you complete your exams and all. So guys, here, before going to the guideline, let me show you that what are the important coding concepts you wanted to keep in your mind when you are taking code from surgery. So guys, first point is given here, approach matter. Once we are going to take a surgery code, before that, we should finalize from the operative note or the medical report of the patient the procedure or the surgery they are doing in which approach. Approach means, what are the main approach of surgeries? There are two approaches are given here. You can see that first of all, open surgery. What is it? Open surgery. What does mean by open surgery? This is exactly the doctor doing a surgery, a type of surgical procedure in which the surgeon make a large incision cut in the body to directly access the operate on organ or area of interest. Here guys, when the doctor is doing open surgery, definitely they will open your body, the skin they will cut or incise, and they can directly access the body part and they will operate the session. So after the surgery, they will suture that or they will close that. We can consider it as an open surgery. Here, directly you can access, the surgeon can access the body part directly. So what are the examples given here, guys, for the open surgeries? Open appendectomy, open heart surgeries, incisions, excisions, repair. These all we can consider as open surgeries. Then at the same time, can you see the second one, closed surgery? What does it mean? In open surgery, we are doing by cutting the skin and the doctor can directly access the body part. But closed surgery was entirely different. Here, the doctor will not make a large opening or large incision into the skin. This is, we can also call minimally invasive procedure. See this, closed surgery is a type of procedure performed without making a large open incision, where the treatment is done using small incision or instruments or external manipulation. Without making a direct access, we are doing the procedure here. This is what closed surgery. Maybe you heard about it, laparoscopy, endoscopy, cystoscopy. Scopy, what is the meaning of scopy, guys? Some wire with camera that we are accessing on the tip of the wire, we are inserting into the body through the natural opening or the small incision that we are creating in the skin. These are all procedure we can consider as closed surgery. Without making an open, externally we are doing the procedure. So example you can see, guys, laparoscopy and endoscopy. Okay, this is the main examples you can see under the closed surgery. So let me show you that what is meant by endoscopy first. See the picture, all of you. This procedure is completely closed. Here we are not opening the body part. Your doctor will access the wire with camera which is connected and they will insert this wire through the natural opening of the body. See this, endoscopy is a procedure that uses a flexible instrument called endoscope to visualize internal organs through natural opening or small incision. Okay, so can you see the picture of endoscopy which is showing? Maybe through the mouth, maybe through the nose, maybe through the anal region. You can see the colonoscopy showing here. So anyway, guys, this is a closed procedure. And this endoscopy, which is again divided into two types. Most of the people have difficulties to converting the code for endoscopy while coding. This is the main reason for that. Can you see, guys? The endoscope is again divided into two types here. What are the two types given? Diagnostic endoscopy and surgical endoscopy. So most of the people are facing issues for to confirm that endoscopy is diagnostic and surgical. How we can define that? What is the main criteria to differentiate these two items? Diagnostic endoscopy means the procedure performed only to examine and diagnose the condition. So guys, if you see that the doctor is examining for to diagnosis the service, for to diagnosis the disease. Before the treatment, the first time they are doing the endoscopy. So all these things we can consider as diagnostic endoscopy. To disease, confirm the disease. Okay. At the same time, what is surgical endoscopy then? Once the doctor diagnoses the disease, he will do the treatment. So, treatment or surgery we are doing by using endoscopy. This we can consider as surgical endoscopy. Can you see, guys? An endoscopic procedure used to treat or perform the surgery inside the body. So, this is the main difference between diagnostic and surgical endoscopy. So guys, same like this, we already discussed one more example is there, laparoscopy, right? Same like endoscopy and laparoscopy is a closed surgery. So can you see the laparoscopy procedure here? What is the difference between normal endoscopy and the laparoscopy? Usually, normal endoscopies we are doing through the natural opening, like nose, mouth, anal region. But what is laparoscopy, guys? This we can call keyhole surgery. Here, the doctor will or the surgeon will make a small hole, especially nearby your tummy or pelvic area. And through this hole, they will insert the endoscope. So, laparo, the meaning of laparo, which means abdominal wall. So laparoscopy refers to a minimally invasive surgical technique in which the procedures are performed through small incision using a special instrument called laparoscope, a thin tube with a camera. So guys, this is also a closed procedure example, same like endoscopy, laparoscopy. Okay, so as usual, we discussed that the endoscopy is divided into two types, diagnostic and surgical. Same like that, guys. Here also you can see the diagnostic laparoscopy and surgical laparoscopy. Do you see that? What is the difference between? Same what we discussed in the endoscopy before, same like that. Diagnostic and laparoscopy means which is used to examine the diagnostic conditions. And what is meant by surgical laparoscopy, guys? A laparoscopy, it is used for to perform the surgery, to perform the treatment, to give the treatment. So, guys, these are the two types, diagnostic and surgical. So, whenever we are taking the codes from the genitourinary system or any other surgery chapters related to the CPT, you should confirm that the surgery is open or closed. So, we have separate code for the open procedures and closed procedure. This is the easiest method to find out the surgery was open or closed. Okay, so these are the basic things coming under the approach of the surgery. Now, here I'm going to show you a tricky methods to be noted for the endoscopies. Now we discussed that the endoscopy and laparoscopy, which is divided into diagnostic and surgical. Can you see, guys? This equation will help you to keep in your mind once you are taking the code from any endoscopy, what should you code? Can you see that? What is the equations given here? First equation is showing diagnostic endoscopy plus surgical endoscopy. Why it is mentioned like a plus sign here? You know, guys, sometimes the doctors, the surgeons will do the diagnostic endoscopy and surgical endoscopy on same operative session. At the same session, they are doing diagnostic and surgical endoscopy. Here, as per the rule in CPT, we should code only surgical endoscopy. That is the guideline. So, diagnostic and surgical endoscopies are coming together. We should code only surgical. Because, guys, why we are not coding here diagnostic endoscopy? In every surgical endoscopies, diagnostic endoscopies are included in the package. I mean, it's bundled in the package, so we don't want to make it separately. So only we need surgical endoscopy in this case. At the same time, can you see about the laparoscopy? Same guideline you can follow. Diagnostic laparoscopy plus surgical laparoscopy, which is coming together. The same rule you can see, surgical laparoscopy only we need to code. So guys, please to be noted, if two items, diagnostic or surgical endoscopies or laparoscopies are coming, you should go with surgical only because the diagnostic was bundled in the package. You don't want to code it separately. Okay, now let's see the one more equation given here. Closed surgery plus open surgery, which is showing code only open surgery. These all are tricky methods you wanted to use while handling the operative notes before coding. Okay, it will help you to take the codes easily. So what does it mean, guys? Closed surgery and open surgery indicating. If doctor started the surgery with the closed manner, maybe they are using endoscopy. Okay, but at the middle of the session, they removed the endoscope. They started open the skin and do the procedure. So closed surgery became open surgery. Sometimes it will happen. They cannot complete the surgery by using the endoscope. So they will remove that, then they will make it open. So in this case, what we will do is, so closed plus open surgery is coming together. So in this case, we should code only open surgery. We don't want to code closed. So this is the another method you should keep in your mind before taking the codes from surgery. So guys, if closed and open will comes together, you should go with open surgery only. So this is the guideline related to the main important coding concept of surgery codes. So hope you understood about the open and closed surgery and what are the things you want to follow. So whenever you are taking the codes from the surgery part, if it is genitourinary system also, you should should read the scenario. You will find out this is an open or closed procedure. After this, next method is what? Confirming open and closed surgery. Then you can see here, in every surgery, there will be a global surgical package you can see. What is global surgical package, guys? Let's see this. It's concept defined by American Medical Association in CPT coding, where all routine services related to a surgical procedures are bundled into one single payment or code. So, guys, as usual, if we are paying for a surgery, in every surgery, there will be a global surgical package. What does it mean, global surgical package? What are the packages included in every surgery that we are going to discuss? Let me show you that. What are the global surgical package will covers? See this? What is it included? So, it covers three phases of care. You can see that three phases of care. First of all, pre-operative care, then intraoperative care, then post-operative care. What is it? Once we are doing a surgery, the patient will pay for the surgery. So in this package, every surgical package, these three items or three phases are already bundled. We don't want to code it or pay it separately. So first of all, pre-operative, before surgery. What are the pre-operative services, guys? Can you see? Evaluation just before the surgery, pre-operative visit usually within 24 hours or same day. And after that, intraoperative. Intraoperative means they will do starting the surgery. During the surgery time, what are the services they have to be given? The surgeons. The actual surgical procedure, normal supplies and services, surgeon works. These all items are included in intraoperative surgery. Then next one, post-operative. This means after surgery. Post means after. It include follow-up visits related to surgery and wound care, dressing, suture removal. These all things. So guys, these are the main three phases which included in every surgical package. It is bundled. We don't want to pay or code it separately. Hope you understood. Now, we are moving to CPT guideline for genitourinary system. So guys, first of all, the surgery approach I told you because this is the main key component once you take a code from the genitourinary system, open or closed, you want to check, and the guideline that we discussed. Now, let's see what are the CPT guidelines related to genitourinary coding system. First of all, understanding the CPT code range. So guys, before going to take the codes, let's see the code range of urinary and male reproductive, female reproductive system given here. So, urinary system, male and female, it's given in different code range, but all you can see start with 5 series. Okay, now this is the first thing you should notable. Next thing, approach of the procedure you should find out from the scenario. So guys, for every patient having different conditions, so the doctors are giving different treatment services. So I already told you about the approach from the beginning, open, closed, surgical, endoscopy, diagnostic and all. So every time once you take the code, approach of the procedure you should be confirmed. See, always identify whether the procedure is diagnostic, surgical means open surgery or closed surgery, if it is endoscopy or laparoscopy, these things you should keep in mind. Then after that, bundling rule of endoscopy. This is also we already discussed, guys. Bundling rule means we have two types of endoscopy, right? Wherever you can see the endoscopy procedure, if the doctor is doing diagnostic or surgical, these diagnostic endoscopies are included in the surgical endoscopy. That means bundled rule. Like diagnostic and surgical endoscopy comes together, we should code only surgical. Can you see there is an example given here? Diagnostic cystoscopy. Cystoscopy means bladder endoscope. Plus surgical cystoscopy will comes together. Code the surgical cystoscopy only. The same thing that we discussed before. This is the third rule you should keep in your mind. Next, the fourth thing, understanding the laterality or side. So, guys, before taking the code, we should confirm that the doctor is or the surgeon they are doing the procedure in which side of the body. You can see that laterality, left side or right side, or maybe bilateral. Bilateral means two side. Can you see there is an example showing here? Kidneys are paired organs. So if the procedure doing in both side, we can consider it as bilateral, right and left side. So this is also one of the key component you should keep in your mind while taking the code from genitourinary. Next, key requirements of EC insurance approval. So guys, before going to the main codes in CPT of genitourinary system, let's see the easiest method of the what are the main key requirements for to get the easy insurance approval. So it's just showing a few key components only. Let's see what is the first point we should know. Valid medical necessity. So guys, once we are giving the for the claim or pre-approvals and all, so whatever the things we need to follow, we should follow that. Otherwise, there is a chance to get rejection. So guys, these points will help you to know what are the easy methods to correct and to give before the insurance approval. The first point is valid medical necessity. What is this? The doctor must clarify and justify why the procedure or test is needed. That means we should mention the patient signs, symptoms, or diagnosis. That means ICD codes. ICD-10 CM codes we should mention under the medical necessity. So there should be a proper diagnosis we need to do a treatment. So under medical necessity, they should mention the proper diagnosis and clinical findings. The second requirement is accurate coding, ICD plus CPT. So the doctor should mention that what is the diagnosis code from ICD and what is the exact code for CPT. If we are not giving the proper codes, if ICD code and CPT code, the procedures are not matching to your diagnosis, definitely there is a chance to get rejection. Okay, so there will be an accurate coding we needed. Then the next requirement for insurance approval is complete clinical documentation is needed. What does it must be included? What are the main clinical documents, guys? The patient history, the physical examination of the patient, body system, and diagnosis, treatment plan, doctor signatures and stamp. So guys, is there any documentations are missing? Automatically rejection will happen. This is the third requirement you should keep in your mind. Then fourth one, pre-authorization or pre-approval. So guys, if you wanted to give a claim, approval, you have to get a approval from the insurance. Definitely, this is one of the main thing you should do. Pre-authorization or pre-approval. Usually, oh, too many people know that what is this process. Before giving the treatment, we should take a pre-authorization from the insurance side. That means the service will covered or not in the patient insurance. So it will helps you to note that the patient have to pay or not. That means if the insurance is not covered, the patient have to pay from their own side. Otherwise, it will include it in the insurance. So pre-authorization is one of the main thing which is doing before giving the treatment to know about the services which included in the patient insurance or not. So what are the main things required, guys, for the pre-approval process? See, there's the required for surgeries. Pre-approval, definitely we should give if we are doing any surgeries. And advanced imaging like MRI scan, CT scan, it should be needed. And some procedure like cystoscopy, circumcision in older patients. Too many things, too many procedures are should be needed pre-authorization. And what are the things included under the pre-authorization, guys? It should be, we want to show that the doctor's orders, how many treatments, what are the things the doctor ordered, and their reports. See, supporting reports we need, and cost estimate also. What is the total payment it should come? These are the main things comes under the pre-approval. So this is the one of the main keyword we should take before giving the claim submission. Now let's see supporting reports. Supporting reports, it's related to your lab results, ultrasound reports, and the previous treatment records. It will help to strengthen the medical necessity also. This is the fifth point we should keep in the for easy approval. Then the sixth one, follow the UAE insurance guideline. We know that as usually we are following the UAE insurance guidelines for this, especially the DHA, Dubai Health Authority, and DOH, Department of Abu Dhabi, Health Abu Dhabi. This is the one of the main part we should follow. So they will check that what are the covered benefits of the patient and frequency limit, number of items they can add, like number of treatment they can take, their limits, and policy exclusions. What are the things not included in the policy? These all are the things we need to check before doing. And then the eighth requirement is what? Active insurance and eligibility check. Definitely, we should confirm that the insurance validity before giving to the claim submission. The validity, the patient insurance is valid or not. Okay, the network, hospital, and coverage limits also. What are the main TPA, third party payer? What are the main insurance they are using? What is the total coverage limits? These all things are comes under active insurance and eligibility check. This is also one of the main component. So guys, these are the main areas we should know about before giving to the insurance. So valid medical necessity, accurate coding CPT and ICD, complete clinical documentations, pre-authorization report, and supporting reports, follow the insurance guideline related to UAE, and active insurance and eligibility check. These are the main keywords we have to keep in mind before this. So hope you understood all of you. So now we are going to the main procedures we are going to do in genitourinary system. What are the main areas? Okay, we cannot able to discuss all the codes and all the buttons because of the time. So let's see what are the main important procedures we are going to do, especially for the patients. Okay, so the first one, let's see the cystoscopy. So guys, what is cystoscopy? It's an open procedure or it's a closed procedure? If you don't mind, anyone please can answer the answer for in the chat. Anyone please? It's an open procedure or it's a closed procedure, guys? You can put your answers on the chat. Okay, thank you, thank you. Okay, yes, of course, it's closed procedure. So what is meant by cystoscopy? Cyst means it's a part of urinary system, the bladder. What is the main function of bladder, guys? It's showing that the storage of urine. After the production, you can see the storing of urine. It's in the urinary bladder only. Okay, so cystoscopy is done. Look inside the bladder and urethra to diagnose or treat the problems of this area. Okay, so here you can see the procedure is showing in the picture. Endoscopy was inserted. See this? Inserted into the area of urethra, enters to the cysto or bladder area. So guys, what are the common reasons for to do the cystoscopy? Like if doctor want to order the cystoscopy, there should be needed some specific diagnostic conditions. Like what are some reasons we need, symptoms we need. What are the main common symptoms, you know? See this? One of the examples given here. First of all, blood in urine, hematuria. We heard about it. This is one of the main common condition, especially come in the area of urinary system disease. So patient presents with the visible blood in urine. So definitely doctors want to perform the cystoscopy. They have to check that what is the reason behind this blood. Maybe it's stone, maybe it's tumor, maybe any other infections. So this is one of the reasons behind the cystoscopy. Let me show you another reason. Yeah, see this? Suspected bladder tumor or cancer. Maybe some patients having issues of bladder tumor or cancer. Maybe this is also cause urine, blood in urine. See this? Or maybe any other issues it can show. See, used for diagnostic and biopsy. Cystoscopy we can use to diagnose this condition and maybe to helps to took biopsy. What is biopsy, guys? If the patient is showing any symptoms of cancer or tumor, definitely there is any suspicious mass in our body, definitely doctors will take biopsy. We should conclude that this specimen, this mass for the area was cancerous or not. Okay, so definitely they will took a cystoscopy in this case, obviously. So guys, sometimes cystoscopy they will do with the biopsy also during this time. Biopsy means specimen we are taking from the living organism, which helps to confirm the diagnosis before the treatment. So this is one of the reason, the second one. And third one you can see guys, an urinary retention or difficulty passing urine. Sometimes some patients will get blockage for the urination. They cannot able to pass the urine normally. So in this cases also doctors will do what? Cystoscopy procedure. This is also another example. So guys, too many examples are there. Reason behind the cystoscopy. I'm just showing few examples only here. Okay, so cystoscopy is one of the main procedures that you can see in the genitourinary system. So guys, let me show you a point to be noted here. We already discussed that cystoscopy, it's a surgical procedure, but it's a closed procedure, not surgical, closed procedure. We can use for both diagnosis the disease and both to do the treatment. So guys, if surgical endoscopy and diagnostic endoscopy will comes together, we should code only what? The surgical endoscopy. See this? If cystoscopy is done with the treatment or biopsy removal is mentioned, code surgical cystoscopy only. Do not code diagnostic separately. The same method we discussed before. Only code surgical cystoscopy. So guys, let me show you an example question for this. See this question, guys. A patient undergoes diagnostic cystoscopy. Okay. And during the same session, the physician performed urethral catheterization. So guys, the patient undergoes diagnostic cystoscopy. And during the same session, what the doctor doing here? He performed urethral catheterization. also. So guys, the scenario that we discussed before, diagnostic cystoscopy is bundled into the catheterization code. Can you see the answer given here? 52005. What is it? See the code description. Cystourethropy with urethral catheterization, with or without irrigation, initialization, or urethropylography exclusive of radiological service. Guys, this is the expansion of the code 52005. Actually, we are not coding diagnostic cystoscopy separately and urethral catheterization separately. Why, guys? This is a combination code. Combination means two items are mentioned, the two procedures are mentioned in one code. So this is a bundling procedure, bundled procedure code. Diagnostic cystourethropy already inside the procedure. So we should code only, we can consider it as only one procedure code. Okay, so this is an example for the cystoscopy procedure. Hope you understood all of you. So guys, cystoscopy is one of the main treatment or procedures we are doing in the urinary part. Now we are moving to the next treatment. This is also one of the main procedure we are doing, especially for the kidney failures. Nephrectomy. What does mean by nephrectomy, guys? Nephro means kidney. Ectomy. Ectomy means surgical removal. So guys, the medical term is indicating surgical removal of the kidney. This is also one of the common procedures we are doing, especially for the lost kidney function, the end stage of renal disease, final stage. We are doing the transplantation. Before transplantation, we will remove the kidney from the donor body or from the recipient body. So nephrectomy, okay. So these are the main CPT codes for the nephrectomy, guys. Can you see the picture showing here? The type of nephrectomy, guys. Let's see the picture. Partial nephrectomy, radical nephrectomy, simple nephrectomy, laparoscopic nephrectomy. See that? Robotic assisted nephrectomy. These are the different types of nephrectomy. So in our CPT textbook, we have different codes are there related to nephrectomy only. Okay, see the codes given here. Simple, radical. See, simple nephrectomy means what, guys? Nephrectomy including partial ureter removal. And at the same time, radical nephrectomy, can you see the code? Removal of entire kidney, surrounding fat, and sometimes adrenal gland also. At the same time, you can see partial nephrectomy, removal of only part of kidney. And laparoscopic simple nephrectomy, laparoscopic radical, which is using with the laparoscopy method. And donor nephrectomy, this is for the kidney transplant for donor purpose during the time of transplantation from one body to another body. This is one of the main common procedures we are doing. Okay, now let's see the another treatment, the common treatment we are doing, renal pelvic catheterization. This is also the another type. What is this, guys? Renal pelvic catheterization means usually the catheterization, most of the people have any doubt with this. Catheterization means what? Usually people are asking every time. Catheter, it's a kind of tube we are inserting into the body. So what is meant by renal pelvic catheterization, guys? It's a procedure in which catheter is inserted into the renal pelvic, the upper part of the kidney that collect the urine. To drain the urine, inject contrast or evaluate obstruction in urinary tract. Guys, basically this catheter tube we are inserting for too many purpose. Sometimes, usually we are using for to collect the urine for the bedridden patients. Okay, collect the urine. Maybe it will inserted through your urethra, maybe through skin to kidney. Two methods are there, or sometimes evaluate the obstructions in urinary tract, or sometimes used for to give injections, contrast material. Too many methods we can use. So this is one of the main common procedures you can see we are doing here. Okay, then now the next procedure you can see, this is also one of the main part, circumcision. What is the meaning of circumcision, guys? Surgical removal of foreskin, prepuce of the penis. Okay, this is also the common procedure you can see for coding. So this here you can see too many different types of codings are there in circumcision. So before that, going to codes, let's see the type of circumcision is mentioned here. Can you see two types are there? Neonatal circumcision and non-neonatal circumcision. So neonatal means it's for the babies, delivery up to 28 days. That is, we can consider as neonate, right? So circumcision we can do in both the neonate and both non-neonate. So what is meant by neonate and what is meant by non-neonate? Non-neonate we can say adult patient also it will comes under that. Okay, so what are the methods we are using for the neonatal circumcision? It's given here. Clamp, dorsal slit, these are the items, methods of procedure to do the circumcision. At the same time, non-neonatal infant circumcision means it's include infant, children and adult also. Usually formal surgical excision we are doing here. And now let's see the code for circumcision in CPT. These are the main important codes usually we are using for circumcision procedure, guys. What is it? First code you can see 54150. Circumcision using clamp or other device with a regional dorsal penile or ring block. Here, circumcision we are using with the clamp or other device. And there is a specified regional dorsal anesthesia also included in this package. This is one of the code we are using. And at the same time, you can see 54160. Circumcision, surgical excision other than clamp. See the difference, guys? Don't let confuse. Sometimes people are getting confused while taking the code from the circumcision because of the material method they used. So first code we are using with the clamp. Second code we are using surgical excision other than clamp or device. They are using another method. Here you can see we have code for newborn also. At the same time, can you see the 161 code? This is for older than 28 days of age. So for the code, newborn is different and older than 28 days, maybe children, infant or adult, you can see here. At the same time, there is another code you can see 54163, repair of incomplete circumcision. This is also very important, guys. See, this code we cannot use for the first time circumcision because first time circumcision is there. That means that the patient is doing for the first time. You can use 5060 or 61 code only. But what is 63 indicating, guys? This is a repeat circumcision. Repair of incomplete circumcision means used for remaining foreskin that need to removal or repeat the circumcision. This is not a primary circumcision. So guys, after the first procedure, maybe some patients will get infection or continuous bleeding or any problem. They will come back to hospital to see the doctor again after the first circumcision. Maybe there is any kind of skin remaining on the area, the doctors want to remove it again, there is chances. Okay, so if patient is coming for the second time, we can consider it as incomplete circumcision repair only. So this code you should use only when for the second visit of circumcision after the first attempt. So guys, these are the main important codes comes under the circumcision. So let's see that some kind of things you should be keep in your memory. See this to be noted. What are the main idea? Like what are the main requirements to take the code for circumcision is you should confirm with age of the patient first. It's newborn or older. Okay, then you should check the technique they used. What are the techniques mentioned? Clamp, VS, surgical excision. Okay, and one more thing, local anesthesia is always included in the procedure. Do not code it separately. Okay, keep in your mind, local anesthesia separately often included. That means do not code because every procedures related to the circumcision, this anesthesia was local anesthesia was already included. Clear with this? Now, for the circumcision procedures, guys, there should be some complications are there during the time of pre-approvals and submission, claim submission. Let me show you what are the main theme related to insurance guideline for circumcision. Let's see this. UAE insurance guideline related for the circumcision procedures. Can you see? In the UAE, DHA, DOH, MOH frameworks, circumcision coverage depends on medical necessity. Medical necessity means what, guys? There should be a proper diagnosis. Then only it will cover under the insurance. The medical necessity, it's very important. See, some covered cases are given here. If you can do the circumcision for some covered cases, see, phimosis, paraphimosis, then recurrent balanitis, urinary obstruction. These are the main cases which covered the insurance for the circumcision, and it should, but if it is also covered, there should be must documentation. We have to mention the documentation clearly. See, proper clinical documentation should be given, doctor's justification should be needed, and supporting diagnosis. There should be a proper ICD code also, then only they will allow. Okay, but every time it's not able to get insurance approval from the insurance side because of circumcision is very rare case in the coverage of insurance. Let's see, non-covered or limited. What does it mean, guys? Some cases, the circumcision, it will not covered under insurance, guys. What are the cases which is not covered given here? Routine neonatal circumcision, which is religious or cultural, not covered under this. And also cosmetic procedures. The circumcision we are doing for the purpose of cosmetic surgeries, that is also not covered under the insurance. Usually, these things we have to pay it out of the pocket. From the patient side only, they have to pay. But some insurance coverage are there, which is included the circumcision also. It is very rare. Can you see? Or covered under enhanced plans. It's rare cases also. So, if the patient insurance covered almost every services or enhanced plans are there, then only it will cover. Otherwise, it's not. And for the circumcision, pre-authorization also very important. What is pre-authorization, guys? Before giving the treatment, we should confirm with insurance that service is covered or not. Right? So non-neonatal circumcision, it should be needed a pre-authorization. We should submit the diagnosis, the proper ICD code, clinical notes, and planned CPT code. That means which CPT code they have to be planned. I mean, which treatment method they are going to be do. It should be needed for the pre-authorization also. See, these are the basic things related to circumcision only I'm talking about. Okay, so circumcision is one of the main procedures usually we are doing for men. Okay, now let's see another procedure, prostate procedure. Guys, this is also one of the common type. What is it? Prostate procedure usually we can also call TURP, transurethral resection of prostate. Okay, is a urology surgical procedure used mainly for benign prostate hyperplasia. See this? Sometime see the prostatic gland enlargement or tumors in the area, or we can use the prostate procedure. See, these are the CPT codes related to the prostate. Standard TURP, TURP with control of bleeding. See, resection of growth tissue, repeat TURP, bladder neck construction. See, these all are the procedures related to prostate. Then, another type of procedure, this is also very common, guys. Let's see this, lithotripsy. Lith. What is the meaning of lith, guys? It's stone. Lithotripsy. Tripsy means crushing. You know, this is the procedure we are doing the patient who have kidney stones. Usually, this is a medical procedure used to break down the kidney stones, the urinary stones, into smaller pieces so that can be passed out of the body through your urine. You know, guys, sometimes the stone size is more bigger size. So in this case, the stones cannot be able to pass through the urine. So during this time, the doctors will suggest to do the lithotripsy. It's like we are giving an extra shock wave to the area of your kidney stone, and here through the shock, the stones crushed to many fragments, like minute fragments, and finally it can be passed out of the body through the urine. See the code given here for lithotripsy, guys, 50590. Usually, imaging guidance are usually included in the services. Okay, so this is another type of common procedure you can see. Next, you can see ureter procedure, guys. Ureter means what? The tube which connected from kidney to bladder. See some procedures given here. The category, common codes, and the purpose also given here. Ureteroscopy. What is this? Endoscopy procedures in the ureter, which is especially we are doing for to know about the stones and biopsy removal. Okay, then stent placement. Stents. We are usually keeping stents to prevent, especially for the drainage purpose or to prevent the stones and all. Then lithotripsy. Here also stones will get blocked on the ureter. Sometimes you can do the lithotripsy, crushing of stone. Hmm? Then we can do open surgery also here. See the codes? Removal of stone or removal of anything inside the ureter. Then reconstruction or repair. Then catheterization. Catheterization means what, guys? I already told you that tube we are inserting for the purpose of collection of urine or drainage purpose. So these are the procedures related to ureter. So now we discussed too many procedures, guys, but we missed one of the important area, the pregnancy. Now we are moving to the pregnancy, delivery, and postpartum cases in the genitourinary system. So, guys, here in the genitourinary system, the last session, the female reproductive area, you can see the code for delivery code, postpartum, antepartum care codes, and all. So, what are these items? What are the main important guidelines we have to keep in the mind? So, guys, before that, let's see the pregnancy, delivery, postpartum phases are given here separately. So, pregnancy period that we can call antepartum period, guys. What does mean by antepartum period? The period before delivery. The period before delivery. Okay, during this period only we are going to hospital and doing some tests, ultrasound to check the baby condition, to check the mother condition, everything. Then see this antepartum period, it should be divided into 3 trimesters. Can you see the trimesters and the weeks given here? So during the pregnancy time, the trimesters are very important to mention in every pregnancy and maternal report because we should mention that the patient is under which trimester, under which period, under which week going on. See, the antepartum period, which is divided into 3 trimesters, the first trimester, second trimester, and third trimester. So these trimesters, this is the phase for the developing of fetus inside the uterus. So guys, let's see. First trimester is equal to 0 to 13 weeks. Then second is equal to 14 to 27 weeks. And third trimester, we can consider it as 28 weeks until delivery. So guys, during this trimesters, we should go for the prenatal visits for some tests, whatever the things we are doing before the delivery, all you can see here. Okay, at the same time, after antepartum, like after pregnancy period, the baby will deliver, right? That is called delivery phase. Can you see? We have 2 types of deliveries are there, vaginal and cesarean. Then after delivery, the postpartum will start after delivery, the period after delivery. So, guys, here we are going to discuss what are the different procedures comes around this antepartum delivery and postpartum phases. Okay, so most of the people have doubts with that, like before, what will the doctors do if the patient comes with the symptoms of pregnancy, and what are the initial visit documentations? This is very important. Hmm? So, what are the things doctors wanted to note, or what we will do, what we will document if the patient comes with symptoms of pregnancy? This is the one we are going to explain. So, guys, the first thing the doctor must document that, see this medical history. Take the medical history. This is the one of the main thing we should confirm before confirming the patient is pregnant. So, what are the medical history? The doctor will ask about these things from the patient side. So, what are the things they will collect, guys? The last menstrual period, LMP. Okay. Then sexual activity, contraceptive uses, that means any medication or contraceptive pills they used before, and previous pregnancies history, and symptoms also they will try to ask, like vomiting, dizziness, what are the things the patient currently have. This is the first thing the doctors try to collect from the patients. Okay, and after that they will confirm with the patient they did any kind of pregnancy test or not. Maybe we will do any pregnancy test from home, like urine test, urine pregnancy test, or anything the patient already did. That's why they came to the hospital because it's showing the positive symptoms. Okay. Anyway, the second step, perform the pregnancy test. Maybe the doctor will order urine pregnancy test. This is the most common. You will get the quick answer for the quick result for this. See the code given here for urine pregnancy test. Okay. At the same time, they will order beta HCG test. Can you see that? Beta HCG for early or unclear cases. What is it, guys? Maybe some patients already did the urine test from home. Maybe it's not clear. So the doctors wanted to get the proper result, so they will order the blood test beta HCG. Then finally, after doing this tests, we'll come back to the doctor and the doctor will confirm the pregnancy, it's positive or negative. If it is positive, see this C32.01. This is the ICD code actually that's showing the pregnancy positive cases. Okay. Now, after this, the doctor will order. So, first of all, medical history they will take. Then they will perform the pregnancy tests to confirm the pregnancy is positive or negative. Then the third step, physical examination they will do. Doctors will order some kind of physical examination, guys. What is physical examination? Like some general checkup, like your blood pressure, the weight, and pelvic examination if needed to access the uterus size. Some kind of physical examination they will order. Same like that, the ultrasound method, ultrasound procedure. Ultrasound, it is one of the main radiological examination we are doing during the time of pregnancy period. So order the ultrasound. This is the fourth point. Usually then after a few weeks, see, we should confirm the pregnancy first of all. Then after submitting all the data, if the patient was positive in pregnancy, then the positive cases only we can assure that we can take the ultrasound. See this? Usually done after a few weeks once the pregnancy was confirmed. Okay, here the ultrasound will help you to location of the pregnancy. Location of the pregnancy means what? We should confirm that the baby was in the uterus or not in the uterus. Ectopic pregnancy, guys. Tubal pregnancy, which is not in the uterus, other part of the uterus, if the baby, the zygote is there or the embryo is showing, we can consider it as ectopic pregnancy. It helps you to find out through the ultrasound only. And then you can see gestational age. Ultrasound helps you to find out the trimesters or week, gestational age, and also the fetal heartbeat. So guys, ultrasound actually there is some specific coding guidelines are there for ultrasound in pregnancy according to the UAE standard insurance rule. So let's see what are the main ultrasound guidelines in pregnancy. Okay, see here are standard ultrasound guideline for the pregnant patient in UAE based on DHA, DOH and MO, HAP practice and insurance rule. This is the common authorities here in UAE. So what are the main things you should follow for to take the ultrasound for the pregnant woman? And what are the very important things we should keep in your mind for the coding purpose, for the clinical understanding? Okay, so the general rule is given here for ultrasound. Ultrasound is a routine, but it's regulated. Guys, the 3 trimesters are there for the patients, right? So each trimesters, there should be an ultrasound. It's regulated for every pregnant woman. Okay, and see, each scan must have a clinical purpose. There should be a clinical purpose for the scan. And unnecessary scans are not allowed unless it's justified. Guys, there is a limit for the ultrasound process. It's not possible you can take ultrasound how many times your patient want or how many times the doctor want. It's not like that. Unnecessary scans they will not allow to include in, especially in the insurance case. Okay, so there should be a proper ultrasound procedures are there. That's why it's showing here. It's regulated, routine but regulated. So guys, let's see that what are the types of ultrasound we are going to do for the patient, sorry, for the pregnant patient. Let's see the first one. Standard ultrasound schedule in UAE. Standard, which is usually we are doing. This is the first ultrasound usually we are taking, guys. See this? During the time of 6 to 10 weeks. This is the time period. So purposely we can also call the early dating scan. This is the first ultrasound usually we are doing. We can also call it early dating scan. See this? It helps to confirm the intrauterine pregnancy, especially to confirm the pregnancy and detect the fetal heartbeat. Okay. And also ruled out ectopic pregnancy. This is the first one we discussed before. This is the first one we are doing and calculate the gestational age, the trimester and the week. So guys, this is usually done through the transvaginal ultrasound method. And this is often the first scan done after the positive pregnancy test. Okay, this is the first one we are doing. Then, second one you can see late first trimester screening scan. We can also call it NT scan. NT, neutral translucency. That is NT means. Usually this we are doing 11 to in between 11 to 14 weeks. We can also call it late first trimester scan. Late first. Okay. What is the main purpose of this scan, guys? Check risk of chromosomal abnormality, genetical disorders, and measure the notional translucency, especially to confirm the Down syndrome for the baby, and combined with some blood test also, which is included. Okay, this is what late first trimester screening scan. Then after that, you can see second trimester, we are doing the another test which is called anomaly scan. This is another ultrasound we are doing in especially in second trimester. Here, usually we are doing in between 18 to 22 weeks. What are the main purpose, guys, mentioned here? Detect the fetal structural abnormalities to find out the structural issues. Okay, the baby body or structural issues, it helps to find out. And also it helps to check the organs, brain, heart, spine, and kidneys. And also helps you to find out the placenta location. Okay, it must be done in all pregnant patients. If the service is not doing properly or during the time it was not completely done, you should repeat the scan within 2 to 3 weeks. Okay, so this is the another ultrasound indicating. Now let's see the last one, third trimester scan, growth scan. It helps to find out mainly the growth of the baby. Especially this is doing during the time of 34 to 36 week of pregnancy. And what are the main purpose, guys? Access fetal growth. Helps to find out the fetal growth. Amniotic fluid level. The fluid inside the uterus which the baby was lying on. The level of fluidity we can be able to know. Fetal position helps to know the fetal position. And Doppler test is also maybe sometime we will take in this case. So guys, in low risk pregnancy cases, we will take one scan only. Can you see the point given here? If the pregnancy was normal, one scan only is needed in this growth scan. But if it is high risk pregnancy, sometime we will do more than one time, multiple scans required. So that's why I told you during the medical necessity should be there. Then only we will do the multiple scans. Okay, so these are the main ultrasound procedures and scans related to the pregnancy period. Now let's see, guys, the coding tip. What are the main things you should keep in your mind? Okay, in UAE, the number of pregnancy ultrasound covered by the insurance, but it's limited and depends on your insurance plan. Okay, guys, everyone, the insurance plans are different. So definitely the coverage also will be different. So here in UAE, there is some common general insurance plans are there, which is included some common things like standard coverage. We can say that. What are the standard coverage or most common coverages during the time of pregnancy? Here you can say that usually 3 ultrasound scans are covered during the whole pregnancy. Usually 3 ultrasound. That means 1 scan per trimester. Each trimester will do each scan. So usually 3 ultrasounds are covered, but some during the time of like the patient have some life-threatening condition or any other medical necessity will be there. Maybe more than 3 it will cover. But it's there should be needed the proper ICD condition, the diagnosis condition. So usually we can say minimum 3 ultrasound. And typically, this ultrasound will cover, see, the most insurance will cover these important medical scans. What are the ultrasound scan which covered? First dating scan, then NT scan, then anomaly scan. This is the one that we discussed before, guys. The main scans. Okay. And I told you the minimum, the number of minimum ultrasound is 3. But if it is more than 3, see this important conditions given here. The extra scans or like growth scan, Doppler, etc. It covered only if doctor says medical necessary. So you should be, see, these kind of extra scan after the 3 like a growth scan or Doppler, what we can do. If there should be needed the doctor documentation. The doctor have to say that there is a necessary things to take this extra scan. Then only they will covered under the insurance. And can I see there's another point given here, guys? Third trimester scans may need pre-approval. Usually, most of the services may need pre-approval. But for the third trimester ultrasound, always we should take a pre-approval from the insurance. Okay, and one more thing, 3D and 4D scans are usually not covered in the insurance plans. Maybe if you have some enhanced plans and all, sometimes it's included, but usually 3D, 4D ultrasound scans are not included. Okay, you should pay. Then more than 3, if only if complications or high risk pregnancy. What is that? The insurance will allow to take the ultrasound for more than 3 times when if the patient have any complications or any high risk pregnancy cases. Okay, these are the guidelines related to ultrasound in the pregnant patient, guys. So guys, we discussed about the points, whatever the things we needed to keep in the mind. So first of all, doctors do the medical history, then perform the pregnancy test, then he will do the physical examination. Under the physical examination only we discussed about the ultrasounds. Okay, now let's see that what is the next step he will do, the doctor will do. Initial antenatal tests they will order. You know, tests. There are too many laboratory tests are there we are doing for the pregnant woman, like obstetric panel test, blood group, RH typing, complete blood count, hemoglobin, blood sugar, infection screening, HIV. See, some tests they will order to find out the patient and the mother and baby was healthy. Then at the same time, they will order the supplements and start the supplements and advice. They prescribe the folic acid, give diet and lifestyle advices, avoid upfront medications and substances. These are the other things they will recommend. Then the next one, schedule the follow-ups. You know, guys, every pregnant woman will come to the hospital for the monthly checkup, routine antenatal visit to monitor the mother and baby health, right? You know, there is a number of prenatal visits covered here. It's given. What does it mean, guys? For the normal insurance plans, most basically, there is some eight number of antenatal visits are included in entire pregnancy period. What does it mean? In normal insurance coverage, most basic insurance plans, it will cover approximately 8 prenatal or antenatal visits during the entire pregnancy. So guys, once the patient is going after 8, I mean the ninth visit, we should pay for that. So 8 antenatal or prenatal visits are covered only in the normal insurance plans. If it is enhanced, you will get more. But basically, we can say 8 number of visits. So guys, these are the main things you should keep in your mind during the antepartum period we are giving to the pregnant woman from the side of hospital and clinic. Now, after antepartum, what is the next step, guys? The delivery. Now we are moving to delivery. So this is also called intrapartum period during the delivery, the period during the time of delivery. So childbirth, right? Childbirth is basically, I told you guys, there are two types of deliveries are there, vaginal delivery and cesarean delivery. Okay, so vaginal delivery, we can consider it as natural birth through vagina. But C-section means if the baby was not delivered naturally, we will go with the C-section, surgical birth through the abdomen. So guys, in our CPT textbook, especially in the genitourinary system, you can see all the codes related to delivery. Vaginal delivery code, cesarean delivery code. See, first of all, let me show you that CPT codes for vaginal delivery. You know, guys, here in this session, for the delivery session, some services also included or bundled in the package. For example, antepartum care, intrapartum care, postpartum care. Okay, the care before delivery, the care during delivery, the care after delivery. So this cares also you can maybe see in the codes, which is bundled already in the delivery codes. Okay, first of all, let's see the vaginal delivery code. The baby was born through the vagina. Can you see the code, guys? 59400. This is the first vaginal delivery code which is given, and this package included antepartum care and also postpartum care. So guys, if one doctor is taking the service antepartum, vaginal delivery and postpartum care, you can consider the code 59400. So the three phases, the three cares given by one doctor, under one doctor, the service code you can consider it as 59400. And can you see the second code? 59409, guys. What is this? Which is indicating vaginal delivery only. That means doctor is assisting the delivery only. He is not assisting the antepartum care, postpartum care. So, if the service is taken only vaginal delivery by the doctor, this is the code you should give, 59409. But at the same time, you can see, guys, there is a subcategory code given under that, 510410, including postpartum care. So some doctors will give vaginal delivery plus postpartum care. So you should take the code 59410. So these are the main vaginal delivery codes, guys, according to the three services: antepartum, intrapartum, and postpartum. Now let's see the C-section code. Cesarean delivery. Same like that, here also some procedures are bundled. Bundled means Antepartum, postpartum care also included. Can you see the first code, guys? 59510. Routine obstetric care including antepartum care, cesarean delivery, and postpartum care. What is it? The three phases are included, but the delivery was C-section. You can give the service code 59510. If your doctor is doing only cesarean delivery, then the code will be 514. At the same time, you can see if postpartum care also included, the service code will be changed. It will be 59515. So guys, it's exactly what we discussed before. Same like that. Okay. Now, the third set you can see delivery after previous cesarean delivery. What is this? Delivery after previous cesarean delivery, guys. Already the patient had a previous cesarean delivery history. Maybe now she presents with the expectation of vaginal delivery. So guys, we have a separate session for that to code these conditions. Delivery after previous cesarean. Can you see the codes? 59610, 59612, 59614. This is indicating vaginal delivery after previous C-section. So guys, if she had a C-section status like history, you should take the code from this session only. Like we same like that we already told you antepartum, postpartum, intrapartum phases. So the first code included antepartum care, vaginal delivery, and postpartum after previous cesarean delivery. So the first code you can choose 610. At the same time, vaginal delivery only they are taking after previous cesarean session, then 612 we can consider. And if including postpartum, 614. So guys, every set there is a method. First code always it should be all three surveys. Second code only the vaginal or C-section delivery. Third one including postpartum care. So this is the vaginal delivery after C-section history. At the same time, you can see cesarean delivery after previous cesarean delivery. But sometimes they will try to attempt or make it vaginal again, vaginal after C-section history. But still it becomes C-section again. There is a chances, right? So guys, after C-section, again it becomes C-section. You can take the code 618, including antepartum and postpartum care. At the same time, delivery only the doctor is taking after C-section. This is the code. Cesarean delivery after previous cesarean delivery. Okay. Then you can see 622. If postpartum also included, you should consider 622 code. So guys, these are the basic codes related to delivery. So now we discuss what are the main codes related to antepartum, intrapartum, and postpartum, and the services during this antepartum period. So hope you understood all of you. So now let's see another two main procedure also we can discuss related to the genitourinary system. The other procedure is called hysterectomy. Okay, what does meant by hysterectomy, guys? This is also the common procedures we are doing for the female reproductive area. Removal, surgical procedure which helps to remove the uterus, right? So for what purpose we are doing the hysterectomy usually? For what is the reason behind common medical reasons for removal of uterus, guys? Sometimes fibroids, non-cancerous growth, abnormal uterine bleeding, uterine prolapse, endometriosis, or sometimes cancer, uterus cancer, cervix cancer, or ovaries cancer. These are the main common reasons behind we are removing the uterus from the body. And can you see, guys, the different type of hysterectomy given here? Radical hysterectomy, total hysterectomy, partial hysterectomy. Radical means the surrounding portion. Total means the complete uterus only. And partial hysterectomy means the half of the uterus, the cervix left in the place. So guys, in the CPT, you can see the main hysterectomy codes also. Can you see that? Abdominal hysterectomy through the abdomen. Usually we are doing it like an open surgery. Okay, see the code? Total abdominal hysterectomy. Total abdominal hysterectomy with the removal of tubes and ovaries. Sometimes we will remove the fallopian tubes and ovaries. Okay, and sometimes abdominal hysterectomy, supracervical, partial removal also we can do. And you can see vaginal hysterectomy. This is we are removing the hysterectomy we are doing through vagina. Can you see? It's not an abdominal incision we are giving here. Through vagina only we are doing. Okay, vaginal hysterectomy codes are given here. Then laparoscopic hysterectomy. What is this, guys? Laparoscopic hysterectomy. This is a minimally invasive procedure. Usually we are doing through endoscopic manner. Okay. Keyhole surgery. See the code? Laparoscopic, total laparoscopic hysterectomy, TLH. TLH plus tube or ovary removed. See that? Large uterus. So different codes are there given. Can you see? Laparoscopic assisted vaginal hysterectomy. LAVH. That is laparoscopic assisted vaginal hysterectomy, sometime with the salpingo-oophorectomy also we will do. That means tubes and ovaries also will remove. And then the last type is radical hysterectomy. Usually this is for cancer. Radical hysterectomy through vaginal also we can do. See, cancer related or extensive procedure. So guys, these are the main procedures related to hysterectomy. Now let's see the last one, abortion. This is also the common procedures. Okay, what is abortion, guys? It's a termination of pregnancy before the fetus is viable, usually before 20 weeks of gestation or less than 500 gram, the weight. So abortions, we can see abortion may be occurred in two methods, maybe naturally, natural miscarriage also, or induced. Induced means medical or surgical termination. Intentionally, we are doing. Let's see the type of abortion, guys. Spontaneous abortion usually occur naturally. Okay, spontaneous abortion or natural miscarriage. See the code 59812. Then induced abortion done intentionally without any complication. Sometimes the people are doing abortion. Medical abortion, sometimes they will use medication or surgically they will abort. Surgical abortion procedure may be like, have you heard about dilation and curettage, dilation and evacuation, guys? These are the two types of surgical abortion, D and C and D and E. Okay, dilation and curettage code 58120 and dilation and evacuation 59841. These are the basic procedure we are using for surgical abortion. At the same time, next one, missed abortion. What is missed abortion, guys? The baby, the fetus has stopped developing or died inside the womb, but the fetus is non-viable but not expelled out. This is what missed abortion. Usually, guys, the baby was died inside the uterus, but the baby was not expelled out. It's still in the uterus. In this case, what we will do? Usually, the doctors will do some procedure like a DNC and a D&D. They will remove the expelled, the baby was there and the remaining products of baby and placenta, they will remove out by the method of DNC and D&E surgically. Okay, so this is what missed abortion. See the code 59820, 59821. Then fourth one, incomplete abortion. Incomplete abortion means, guys, this is also almost same like a missed. The baby was aborted, but the product of conception still remain in the uterus. Here also, the doctors should remove the conceptions by using some kind of method. Last one you can see septic abortion. What is this, guys? Septic abortion. Usually we are doing this for because of some infections are spreading. If mother got any infection, there is a chance, very high chance to get the infection to baby also. So if it is going to septic, definitely they will think about the abortion. Okay, so guys, these all are the abortion codes related to female reproductive system. Now, here there is an important CPT rule is there, especially for before we discuss about the surgical procedure, dilation and curettage, and dilation and evacuation, guys. Right? So here we have a coding rule. So let me show you that. What is the coding rule? Let's see, guys. Important CPT rule. What are the important CPT rule mentioned here? I already told you dilation and curettage. Dilation and evacuation is what? It's a kind of procedure we are using to remove the product of conception of baby from the uterus. So, do not code 58120 DNC plus and 58841 D and E together. What is this, guys? What is the meaning of this? Sometime in the question, you can see that, like sometime in the scenario, you can see that doctors start the procedure with a D and C, but at the same time, they are doing D and E also. D and C means dilation and curettage. D and E means dilation and evacuation. You know, guys, D and E is one of the most advanced procedure than D and C. So if doctors start with the D and C at the same time he is doing D and E also. If these two procedures are comes together, we should code only D and E. See, D and E already include uterine evacuation steps. So D and C become bundled or included in the package. So in this case, most of the people are getting trouble in this. So don't take D and C and D and D together if they are doing. Only you should code D and E. That is the guideline. Because D and C is bundled in the package of D and E. Now, let me show you one example question, guys, for this. See this. A 24-year-old patient at 16 weeks of pregnancy is diagnosed with fetal demise. The physician performs cervical dilation followed by evacuation of uterine contents. During the time of procedure, curettage is also performed to ensure to complete removal of tissue. Which CPT code should be reported here? Guys, do you notice that they mentioned about dilation and evacuation and plus dilation and curettage? So I already told you guys, if evacuation and curettage is coming together, what we need to code? We should code only dilation and evacuation. See the code given here, 5984 what? Induced abortion by dilation and evacuation second trimester. 16 weeks is the second trimester. So this is the correct CPT code. So here, curettage, we are not coding, only dilation and evacuation. So guys, these are the common procedures usually we are doing in genitourinary system. We cannot able to discuss all the procedures, so that's why I'm just pick up only the important procedures, common procedures we are doing for the patients. So guys, hope you understood whatever the things we explained today. Now we can go to some example practice question. So yeah,